Now at LLETZ treatment, we're going to do what we did at colposcopy. You look at your cervix under the microscope, put on the dyes that are going to show us the cells with the changes. But then we're going to put in local anaesthetic to numb your cervix. Then we're going to take a small wire on a stick and remove the area that's affected. Then we're going to stop any bleeding, and I'm going to leave a small piece of Surgicel, which is going to reduce bleeding and reduce the risk of infection. The risks of this procedure: risk of bleeding, but as I said, we're going to stop the bleeding as we go. There's risk of infection. That's why we say nothing in the vagina for 3 weeks. If you were to get an infection, you could feel hot, unwell, have pain, and have increased bleeding. If that was the case, you need to see a doctor and get a week's course of antibiotics. There is risk of damage to surrounding tissues, and those tissues are the vagina and the organs behind. Even though we put on the dyes, there is risk that there's some invisible viral changes outside our area, and that could result in incomplete excision and may require repeat procedure. Long-term complications are related to pregnancy. There is a small increased risk of preterm labour or early rupture of membranes, and we call that cervical incompetence. What we recommend is you tell your doctor or your midwife that you've had this procedure so that they can arrange an ultrasound scan to check your cervical length. The opposite can also happen where the cervix heals over too tightly, causing cervical stenosis. This results in difficulty getting smears in the future or difficulty with cervical dilatation in labour.